Hello and welcome. Today we're diving deep into a specific complication that can arise from the use of a common chemotherapy drug, methotrexate stones, in the urinary system. We'll explore what causes them, how they form, who's at risk, and most importantly, how they're treated and prevented. Methotrexate, or X, is a powerful medication used to treat a variety of conditions, including certain cancers, rheumatoid arthritis, and psoriasis. However, a key factor in the formation of methotrexate stones is the drug's relatively poor solubility, especially at acidic pH levels, which can occur in urine. High doses of methotrexate, often used in cancer chemotherapy, lead to increased drug concentrations in the kidneys. When combined with dehydration or acidic urine, the methotrexate can precipitate out of solution and begin to form crystals. These crystals then aggregate and grow, ultimately leading to the formation of stones. Let's break down the process. Once methotrexate enters the kidneys, it's primarily excreted unchanged through the urine. When the concentration of methotrexate in the urine exceeds its solubility, crystallization begins. This is exacerbated by acidic urine. As methotrexate is less soluble in acidic environments, the crystals deposit within the renal tubules and collecting ducts, causing inflammation and obstruction. This obstruction can lead to hydronephrosis, which is the swelling of the kidney due to the buildup of urine. Over time, the crystals grow into larger stones, potentially causing significant pain, kidney damage, and even acute kidney injury. The exact prevalence of methotrexate stones is difficult to determine, as many cases may be asymptomatic or misdiagnosed. However, it is generally understood that the risk is significantly higher in patients receiving high-dose methotrexate therapy, particularly those who are not adequately hydrated or whose urine is acidic. Children receiving high-dose methotrexate for leukemia, for example, are a population at increased risk. Factors such as pre-existing kidney conditions, certain medications, and genetic predispositions can also play a role in increasing susceptibility. The signs and symptoms of methotrexate stones can vary greatly depending on the size and location of the stone, as well as the degree of obstruction. Some individuals may be completely asymptomatic, meaning they experience no noticeable symptoms. Others may experience flank pain, which is pain in the side or back. This pain can be constant or intermittent and may radiate to the groin. Other symptoms can include nausea, vomiting, hematuria, or blood in the urine, and dysuria, which is painful urination. In severe cases, the obstruction caused by the stones can lead to kidney infection, fever, and signs of acute kidney injury such as decreased urine output and swelling in the legs and ankles. Diagnosing methotrexate stones typically involves a combination of imaging studies and laboratory tests. A urine analysis can detect the presence of methotrexate crystals or blood in the urine. Kidney function tests, such as measuring serum creatinine and BUN, can help assess kidney function. Imaging studies, such as ultrasound, X-ray, or CT scan, are used to visualize the urinary tract and identify the presence, size, and location of the stones. A CT scan is generally considered the most sensitive and specific imaging modality for detecting kidney stones, including methotrexate stones. It's important to note that methotrexate stones can sometimes be radiolucent, meaning they don't show up well on standard X-rays, making CT scans particularly valuable. While methotrexate stones aren't typically classified into specific types based on composition like some other kidney stones, their size and location are important considerations. Small stones may pass spontaneously, while larger stones may require more invasive intervention. The location of the stone, whether it's in the kidney, ureter, or bladder, also influences the choice of treatment. The primary goals of treatment and management are to relieve pain, prevent further stone formation, and preserve kidney function. Pain management typically involves the use of analgesics, such as NSAIDs or opioids. Increasing fluid intake is crucial to dilute the urine and promote stone passage. Alkalinizing the urine with medications like sodium bicarbonate or acetazolamide can increase the solubility of methotrexate and help dissolve the stones. In cases of large or obstructing stones, more invasive procedures may be necessary. These can include extracorporeal shock wave lithotripsy, or ESOL, which uses shock waves to break up the stones into smaller fragments that can be passed more easily. Ureteroscopy, a procedure in which a small scope is passed through the urethra into the ureter to visualize and remove the stones, may also be used. In rare cases, percutaneous nephrolithotomy, a surgical procedure in which a small incision is made in the back to access the kidney and remove the stones, may be required. Prevention is key in managing the risk of methotrexate stones. This involves several strategies. Aggressive hydration, both before, during, and after methotrexate administration, is essential to dilute the urine and reduce the concentration of methotrexate. Urinary alkalinization, Using medications like sodium bicarbonate or acetazolamide can help increase the solubility of methotrexate. Monitoring urine pH to ensure it remains above 7 is also important. Some clinicians also consider leucovorin rescue, which helps reduce the systemic toxicity of methotrexate, although its direct effect on stone formation is less clear. Finally, dose adjustments of methotrexate may be necessary in patients with pre-existing kidney conditions or those who develop signs of kidney dysfunction. The prognosis for patients with methotrexate stones is generally good with prompt diagnosis and appropriate treatment. However, if left untreated, methotrexate stones can lead to serious complications, including kidney damage, infection, and acute kidney injury. Recent research is focused on developing more effective strategies for preventing methotrexate stone formation, including exploring novel drug formulations and personalized risk assessment tools. Studies are also investigating the potential role of specific biomarkers to identify individuals at higher risk of developing methotrexate stones. By improving our understanding of the mechanisms underlying methotrexate stone formation, we can develop more targeted and effective prevention strategies to improve outcomes for patients receiving methotrexate therapy. Thank you for watching.